The song Badamwa means, as long as I remain dry, I don't care if my husband rejects me, I don't mind. Even if my mother rejects me, I don't care as long as I remain dry. Even if my father rejects me, I don't care as long as I'm dry. Even if the whole world rejects me, as long as I'm dry, I don't care. It's only being dry that is the most important thing to me, because it's the one that made me an outcast before. So as long as I'm dry, I don't care.
I got married when I was 13 years. I became pregnant after a year. I went into labor for 1 week, and it's like I was unable to give birth myself. And my husband decided to take me to the hospital. And reaching the hospital, I was operated on, and they removed a dead baby. After the operation, it's like the wounds from the surgery was not healing on time. And my husband became fed up and told me that he is going back home to farm and look for money to enable him get married to another woman, because so he can see that I can't give birth to children any longer. He asked me if I know the road to our house, which I told him no. He went out, looked for a motorcyclist, and I was on the bike and tied with a rope around the cyclist, both hands and legs, and tied to the bike carrier like an animal. And the motorcyclist took me down to my parents' house, dropped me on the ground and ran away. What made me weep is because the way I was tied to the bike like an animal, it gave me pain, and it was really a difficult moment. At Evangel Hospital, it was quite different. I'm so thankful to God because I was healed completely, and I don't know how to thank God enough.
IVUmed means Vesicovaginal fistula. It means a situation whereby a woman continuously leaks urine for 24 hours in a day. Normally, labor is supposed to last for less than a day, but when it stays for up to a day and days, and in Nigeria, we've had women who labor for about 1 week. It leads to the destruction of these two bags and links them to the vagina and cause them to continue to leak either urine or feces or both.
The first day we arrived, we had this huge clinic where we screened 50 or 60 patients for surgery.
Good morning. How are you?
I was asking them about their original injury, and over and over and over you hear the same story, that they labored for days and their baby died.
Is the baby alive? Sorry.
Some of our patients are just teenagers that they've gone through so much at such a young age. It's just really disturbing. They just seem like kids themselves.
Do you know how long you've been leaking? And did your leaking start after you had a baby?
That story is classic. That they all seem to have lost their baby, and then this nightmare starts.
IVU has a lot of support to the VVF women and to the caregivers of VVF in Evangel Hospital. When I started the project, I was alone because nobody was willing to work on the VVF project. I found company, I found friendship, I have found people that I can share my frustration with. I have found people that are willing to help. I have found people that are willing to try to get answers for me beyond what I know, not only here when they visit, but even while they are back home. The most rewarding thing about my work is to see patients transformed, to see patients come in depressed and live happy, is to see patients that have lost hope completely, able to live their lives normally and to have children. And they feel we are part of them, not only as caregivers, but also as family members.